Thank you, Dr. Cologne. Great. Okay. So thank you to the organizers for inviting me to speak to you today. I think we can all appreciate that colorectal cancer is a molecularly heterogeneous disease with genetic basis involving multiple pathways, including the chromosomal instability pathway, the CpG island methylator phenotype pathway, as well as the microsatellite instability pathway, which can be associated with both sporadic as well as hereditary cancers. And as we've become more systematic in our evaluation of colorectal cancer, I think we've been able to find that about a third of all colorectal cancers will have a familial component, and about 10% of those will have a well-defined genetic disease. Now here's a list of the more well-known high-risk hereditary colorectal cancer syndromes, and I placed Lynch syndrome up at the top. There are the other syndromes below that, along with the genes associated with the syndrome, as well as their phenotypic features. But I placed Lynch syndrome at the top because the estimated population prevalence of Lynch syndrome is about 1 in every 440. Now compare that with hereditary breast and ovarian cancer syndrome, where the population prevalence is about 1 in 400, and so they're nearly similar. However, it doesn't feel like we're testing for Lynch syndrome as much as we are for BRCA1 and BRCA2, and there's multiple reasons for that. But in response, national organizations like the National Comprehensive Cancer Network have come out with guidelines to help physicians and healthcare providers to identify patients who should go on for germline genetic testing or genetic risk evaluation. And so this is a very busy slide, but it is an algorithm to help physician providers to identify patients based on criteria and then move forward with genetic counseling for specific high-risk syndromes. And I think what you can take away, and the big principle of looking at this slide, is that national organizations are trying to help physicians and providers lower the threshold for genetic testing and genetic evaluation. They're trying to include as many criteria to not only help you identify patients with an underlying hereditary colorectal cancer syndrome, but they're trying to also guide insurers and third-party payers as to who should be covered for their genetic testing and genetic evaluation. And we'll go through some of these criteria. A number of them are just reiterations of the known Amsterdam criteria and Bethesda criteria, which we'll go over, as well as some criteria for moving forward with